Good day everyone, I am Andre, your science nurse for today, and today I'm going to perform and demonstrate evaluation checklist performing the obtaining of electrocardiogram. An ECG is a test which measures the electrical activity of the heart, whether or not it is working normally. It also records the heart's rhythm and activity on a piece of moving paper or line on the screen. Our purpose or goal is to obtain a cardiac tracing via machine without any complications to help in identifying the primarily conduction of abnormalities. We have cardiac hypertrophy, cardiac arrhythmias, pericarditis, electrolyte imbalances, myocardial ischemia, and the site and extent of myocardial infarction. The first thing to do is we're going to place the ECG machine near the client's bedside, and then we're going to plug in the power cord on the wall outlet. After that, we're going to perform hand hygiene and observe for other appropriate infection control procedures. We're going to provide for our client's privacy and dignity by drawing the curtain and closing the door in the room. And then we're going to check the client's identification, comparing what will the client state and his respond. We're going to ask the client to state his name and his age. Good morning, sir. I am Anthony, your science nurse for the day, and today I'm going to perform to obtain your ECG. But before that, can you please state your name and age, please? Thank you, sir. After that, we're going to set up now our ECG machine. And now we're going to explain as well the procedure to our client. Sir, I am going to record your electrical heart activity using a 12-lead ECG, and it might be repeated at some intervals. I'm just going to emphasize that there is no electrical current that will enter your body, and that should be done about 5 minutes. And then we're going to position the client on a supine position or lay down on his back, and then we're going to elevate the head of the bed or put at least 2 pillows to provide to promote comfort to the client. And we're going to ask the client to expose his arms and legs and drape the patient properly. And we're going to ask him to relax his arms and legs. Sir, please do expose your arms and legs and relax them at your side. And then we're going to place the patient on his buttocks if the bed is too narrow, and or if the patient is experiencing shivering or trembling, to prevent muscle tension. And we're going to avoid also the client's touching his feet on the board of the bed. And then we're going to select the flat fleshy areas to place our electrodes, and we're going to avoid for the muscle or bony areas. If the client has an amputated limbs, we're going to choose the sides on his stump. And then if the client is curly, we're going to clip it, and we're going to clean the excessive oils and or other substance that is present on the client's skin. We're now going to apply the electrode gel to the client's skin, or if we're going to use a disposable electrodes, we're just simply apply it to the client's wrist and medial part of the client's ankle by just simply removing the contact paper on the disposable electrodes, or as what is recommended by the manufacturer. We're going to place the disposable electrode to the client's leg properly with the lead connection pointing posteriorly. If we're going to use a disposable, or if you're going to use a electrode gel, we're just going to simply apply it to the client's skin, and we're going to secure the electrodes promptly after applying the conductive medium. Never use a alcohol or acetone pad if we're on the place that we're going to put or place the electrodes. Each electrode has designated color and label. For example, the white color is for the right arm and the black color is for the left arm. The red color is for the left leg and the green color is for the right leg. And we also have for the chest, which is labeled 1 to 6 and has a color of brown. I am now going to apply the electrode. So I am going to use a disposable electrode. So I am going to just simply remove the contact paper, and I'm going to make sure that the metal is bright and clean. So for the left arm is the black color. For the right arm is the white color. For the left leg is the red color. And for the right leg is the green color. We're now going to apply the electrodes in the client's chest area. So we're going to expose the client's chest, and we're going to apply some electrode gel to each of the disposable electrodes. And then we're going to place our first electrodes to the client is the B1 on the client's fourth intercostal space on the client's right chest. The next one is the B2 on the client's fourth intercostal space, but to the client's left chest area. The next one is the halfway of the, for the B3 is the halfway of the B2 or the B4. The B4 is located on the client's fifth intercostal space on the client's left chest area. Next is the B4. The B4 is located on the fifth intercostal space on the client's left chest area. The B4 is located on the chest mid-clavicular area, or just simply below the client's nipple. And we're going to place the B5 on the client's near the B4, but on the client's axillary area or an axillary line. And last is the B6. It is on the fifth intercostal space at the ICS of the mid-axillary line. And just same level with the B4. We're now going to check the paper speed selector if it is set to 25mm. And we're going to check also for the voltage if it's set to the full power. And then we can also, if necessary, we can also input the client's identification data. And there are some machine or ECG machine that we can check the waveform. But before that, we're going to instruct our patient while we're going to record the ECG to still lay down and not to talk. Sir, while I'm going to record your ECG, please just still lay down and avoid talking. And the ECG machine will automatically record all the 12-lead ECG. And we can check before printing out the result, we can check the waveforms if it is not exceeding the right paper size. We can just simply adjust it from full standard to half standardization and repeat ECG. And some other ECG machines have monitor on or screen, and others doesn't have or don't have. We're going to take note also for the changes that we have made because it is necessary before reading the results. And then we're now going to remove the electrodes after our recording and clean the client's skin. And we're going to discard or clean the electrodes as indicated. And we're going to put the client's identification in the ECG results. If not done by the machine, we're going to put the client's name, age, the date today, and the facility identification number. And we're going to document also for all our findings from the client's medical record, the date today, and we're going to simply refer the client's decision if there is any complaint for our client, or if the client has any complaint about the ECG.